Namaste. I'm Dr. Satyajit Godi, and today we will try to discuss some things about piles. Piles are also called as hemorrhoids. Uh, Piles is a very common problem among people these days, and we do hear a lot of people saying that they suffer from piles. So today we will try to understand what are piles and why do they happen and what is the treatment, what is the best way to treat these piles. So coming to the first question, what are piles? Piles are nothing but dilated veins in the region of rectum and anal canal. These are present normally. They are also called as anal cushions, and they do help in maintaining continence, that is the power to stop releasing gas or power to stop passing motions is called as continence. So the piles have a function of helping in maintaining continence in human beings. So these are naturally present, and a lot of time people ask me, is piles present for everyone? My answer is yes. The piles are present for everyone. They are naturally occurring structures in the body, and they do have a specific function, and that is they help in maintenance of continence. To control your release of gas or motions is the main function of piles. So a question that commonly is asked is there any classification for piles, or is there any grades of piles? So I generally follow the grading system for piles. So we have got 4 grades in piles. So grade 1 is when the piles are there inside the anal canal and they are just bulging, slightly bulging into the lumen, and they are bleeding. So these are grade 1 piles. Grade 2 piles are slightly larger in size. So when the person is passing motions, these piles tend to come out of the anal canal, and as soon as the motion is passed, they go back in spontaneously. So these are grade 2 piles. Grade 3 is when the piles come out of the anal canal when the person is passing motions, and you have to manually push it back. So the patient has to use his fingers to slightly position the piles back into the anal canal. And grade 4 is when the piles are permanently outside, and in spite of the patient trying to push them inside, they do not go inside. So these are the 4 grades of piles. We generally get piles which are in different grades. The piles that bleed can be in grade 2, grade 3 or grade 4. So generally when a patient comes to a doctor with piles, he is generally seen in either grade 2, grade 3 or grade 4. Grade 1 piles are very rarely seen these days. So this is how the piles are graded. Now the other common questions that are asked is why did piles happen to me? So when we do see piles in younger generation, younger people also, and they ask routinely as why did piles happen to me, because I hear that piles happen in older age group, but why has it happened to me in my 20s or 30s? Now important thing to understand here is that piles, yes, it is more common in the elderly, but that doesn't mean that it doesn't happen in the younger people also. Now why do piles start bleeding, or why do piles become bigger and become painful? The reason is it is an effect of a constipation or trying to strain for motions over a long period of time. So piles do not happen overnight. I often tell this to my patients that if for a person to have piles, he must be straining for stools, putting unnecessary, undue, excessive pressure for passage of stools, or he must be constipated since a very long time, and this may be in few months to few years. So if a piles has to become symptomatic, it has to be the person must be constipated or straining since a long time. So this is one of the commonest reason that results in piles, in the in our patients. So next we come to the treatment of piles. So when a person has piles, obviously he has come to me for some kind of treatment. Now it is very important to understand that piles can be treated in two different ways. One is the conservative management and one is the surgical treatment. So what does it mean? So conservative management is something where we give medicines and we try to treat the piles without surgery, and obviously surgical treatment is when we advise surgery and you get the surgery done. So in this video I'll be discussing mainly on conservative management. I'll make a separate video for surgical treatment of piles. So number one is how to avoid getting piles. As I said, you should have an excellent bowel movement daily. You should not be constipated. If you're constipated, please visit your doctor and get it treated. Take some medicines, get it treated, maybe do some diet changes, but you cannot afford to be constipated over a long period of time. You cannot afford to be straining for stools over a long period of time. All this is going to end up in you having piles. So the most important step here is prevention of piles. So how do you prevent getting piles is having an excellent bowel movement. And how do you have an excellent bowel movement? Now it is very different for various people. Some people have an excellent bowel movement in spite of eating let's say fast food or street food or eating outside daily, but still they end up having a good bowel movement, whereas some are purely dependent on home food or leafy vegetables or fruits for them to have a good bowel movement. So the moment they eat outside, they end up getting constipation. It is very different for individuals. So for every individual it is completely based on their digestive power. So in general, if you have to avoid getting piles, so please eat healthy, please eat diet that is rich in fiber. So all your vegetables are rich in fiber. Green leafy vegetables are excellent. Please eat fruits. The most common fruit that I recommend for people who are constipated is a banana. It is an extremely cheap food. It is easily available anywhere in India, and just consume maybe 1 or 2 bananas a day and your constipation should be resolved. Dates are other dry fruits which are excellent. They have got high fiber diet, high fiber content, and they relieve constipation. So these are the natural ways of treating your constipation. Of course, we do have certain medicines where when we give a fiber powder or sometimes something called as a laxative, which softens your motion and helps you avoid constipation or straining in stool. So if a person has, let's say, grade 1 or grade 2 hemorrhoids and he's just had a single episode of bleeding, or let's say 1 or 2 minute episodes of bleeding, we generally put them in conservative group. That is, we avoid doing surgeries for these patients and we advise them to take high fiber diet, avoid straining, avoid constipation, drink plenty of water, please do exercise and have a good lifestyle and a healthy lifestyle, and this should take care of his hemorrhoids. But when a person goes to grade 3 or grade 4 or let's say even grade 2, which is not really getting treated by conservative management, these patients are advised surgery. So surgical treatment of piles, I will do another separate video on that. I hope this video has been helpful for people who are suffering from piles and they know exactly when they have to approach a doctor for it, and when you are advised a non-surgical treatment, and when probably you will be advised a surgical treatment for piles. Thank you.